At the Geneva Peace Week 2020, the Center of Competence on Humanitarian Negotiations, CCHN, is organizing live sessions in collaborations with the permanent representative of France to the United Nations in Geneva and the permanent missions of the Federal Republic of Germany to the United Nations in Geneva. The concept of our online sessions is an interactive panel discussion entitled Collective Efforts, How Humanitarian Organizations Ensure and Maintain Access to Deliver Aid and Protections Responding to the COVID-19 Pandemics. It will take place on 4th November at 2 p.m., so make sure to register yourself on the Geneva Peace Week website and add our event to your agenda. We're happy to warm up the discussions on this topic with Benedetta Alessi. She is Access Focal Point for OCHA Regional Office for Eastern and Southern Africa based in Nairobi, Kenya. Benedetta is also a member of CCHN's Global Community of Humanitarian Negotiators. Without further ado, thank you so much, Benedetta, for being with us. Would you kindly introduce yourself and your role within the United Nations Office for the Coordinations of Humanitarian Affairs?
Yes, thanks. It's a pleasure to be here. And my name is Benedetta De Alessi. I am the Access Focal Point at OCHA Regional Office for Eastern and Southern Africa based in Nairobi. And we cover 25 countries from here.
All right. So let's just dig into our topics of discussions. We have seen that humanitarian organizations have different ways of responding to the COVID-19 pandemics. Firstly, could you explain some of the main challenges and dilemmas to deliver aid and protections to vulnerable populations in your operational regions amidst the current pandemic?
Yes, so I think there were three main challenges to accessing people in need and for people to access assistance as well in the region. I think the first one would be movement restrictions. That has been the main challenge that has affected the deployment of staff, surge, emergency response. And immediately after the pandemic, since March, April in this region, a lot of international staff withdrew from the region and that affected our footprint. Then we had internal lockdowns in the countries that affected the ability of humanitarian workers to reach field location from capitals, to access refugee camps, for example, in Kenya. And I have to say that national staff and national NGOs were less affected by the restrictions. Most of them were already on the ground, but they had very limited funds and ability to operate. Curfew was a problem for some organizations and their ability to work, for example, on protection, like some community organizations in support of victims of domestic violence that were mainly occurring at night. So that has been a key feature. And we have seen also GBV, gender-based violence, increasing dramatically in both in Eastern and Southern Africa. And at the same time, access of people to assistance, but also basic services has deteriorated. Also in Southern Africa, that is a region less prone to the use of humanitarian aid, and then especially access to health has deteriorated greatly. And I think that the situation has improved in the past month. There have been more effective negotiation and operationalization of pipelines, movement of goods, also cross-border, that has been effective. So there are more commodities available, but the quality of assistance remains compromised, I think. For example, effective distribution, targeting, monitoring of activities, protection activities, engagement with communities. And overall, since our footprint has been significantly affected, that has taken us backwards in some countries where we have made achievement on access, and now we have lost it. So there is a lot of work to do on that. So the second feature after the restriction of movements has been bureaucratic impediments. Those are a major problem for our our work, humanitarian response globally, and also in this region, and has been more predominantly than violence and conflict. So we had restriction on visa, but also many more layers added for registrations or movement, even when the lockdown was not enforced, approval of trips. So somehow COVID-19 has given the opportunity to some governments to restrict even more humanitarian space. And that's a feature that is remaining even now that some movement restrictions have been lifted. And finally, I think conflict and violence has been an issue, but less relevant than administrative impediments and movement restriction. But probably with the exception of Cabo Delgado in Mozambique. There have been at the beginning of the pandemic efforts to negotiate cessation of hostilities with the non-state armed groups, also triggered by the call of the Secretary General, but they have not lasted for a long time. And we have seen, especially in the past months, resurgence of violence in some key hotspots. And because of our limited footprint and the poor ability of engaging with communities and the quality, our ability to provide protection assistance, we are seeing the effect of that. And for example, in the case of Mozambique, many more IDPs are getting out of conflict areas and seeking refuge in bigger city, which is a deep problem with regards to our ability to protect the population. And in terms of dilemmas, I think for me, the main dilemma in the last 6 months has been the main issue, and yeah, is a dilemma in a sense, because it was the ability of the system to shift and provide direct funding in support of national organizations who had access to people on the ground. So I think COVID-19 has shown a bit the weakness of the international aid architecture, and with regards to timely access and access of people to assistance they needed and protection. And it is interesting how it has intersected with conversation around Black Lives Matters and decolonization of aid towards a more effective funding, direct funding to community organization and frontline respondents. And I don't think this opportunity was truly grasped. There is a lot of work to do, but there are also very interesting conversations happening, including in this region. And I hope they will just generate a real new way of working towards a better access and an ability to help those in need. Over to you.
Yes, I mean, it's very complex, but we see that we're coping pretty much after, let's say, in the last months. And I think now the question is, can you share some examples how you and your team have tried to overcome these challenges and dilemmas while complying with the COVID-19 measures, either regionally or globally? Have there been any specific collective efforts that your team or OCHA has recommended or published? And then I think it's very interesting for us to know some good practice or best practices which have been implemented to continue humanitarian works for your beneficiaries.
Yes, thanks. So I think at OCHA Rosea in Nairobi, what we have done was to support the development, for example, of joint SOPs for the safe movement of staff. And we have negotiated with government to ease some of the restrictions on humanitarian work and, for example, to gazette humanitarian workers as essential staff in the case of Kenya. And we have tried to bring people together and facilitate also the dialogue between the UN and NGOs and government in order to find a way to provide assistance, and despite the restriction and respecting also national lockdowns as well. So taking measures also with regards to provision of PPEs and that. And we have also tried to really raise spotlights on the issue of gender-based violence as well, with many discussions and funds to that. And there have also been efforts for community work with communities in safety and awareness. For example, in the locust response in East Africa, there was a regional response to make sure there was acceptance of the teams getting on the ground, and also no health hazard in that sense. And so OCHA has this unique position in trying to facilitate and bringing people together to overcome some of these issues, and it has worked in some occasions, was effective in negotiating, especially with government in this case of COVID imposed restriction. And I think another stream of work, we are now working in an interesting piece of research in the office around the notion of access and neutrality. We are working with NGOs in Somalia and South Sudan to unpack the principle of neutrality and see what it really means for access on the ground, and especially with regards to the conversation of the colonizing aid, so to speak, who is affected by this humanitarian principle of neutrality, who is imposing it, and how does that affect funding and access to the people in need. And we hope, without now getting to any conclusion, we will also share the results, but we hope to generate necessary changes in the system so that we can better support frontline workers and have better access ultimately to the people in need.
So yeah, since you mentioned about negotiation with your counterparts, as CCHN, we hope that our practical negotiation tools and methods can be utilized within your day-to-day work, especially to negotiate access to deliver aid and protections. Have you recently encountered the situations where you use those tools in a humanitarian negotiation to ensure this access during the COVID-19 pandemic?
Yes, I think the CCHN tool are great and are extremely helpful, have been helpful to me in the last couple of years, and I keep using them. And as I mentioned before, they're very effective in facilitating our work at OCHA, to bringing people together and define positions, for example, reaching joint positions, analyzing position of the counterpart, because often each partner has a different engagement and understanding of the position of governments or non-state armed groups. So we try to bring those conversations and put those pieces together and facilitate reaching joint position and red lines as well. Those are very useful, for example, when engaging with governments to overcome some bureaucratic impediments. And I've used them recently, again, for example, in Burundi, where the government has imposed restrictions on the recruitment and imposed some ethnic quotas. And it was very important there to reach a common position, to negotiate more strongly, and for the respect of humanitarian independence and space. And also in Mozambique, in the engagement with in the conflict in Cabo Delgado. So they can be, so those are very different contexts, but indeed the tools can be adapted and can be used, and also the facilitation tools and techniques of CCHN are very effective. Yes.
All right, glad to hear that CCHN negotiation tools are practical and can be adjusted to your need in the field. So I'm just going on to my last question to you. What's your opinion on how collective efforts and responses to the COVID-19 pandemic are useful for your team, either regionally or globally, or maybe to other humanitarian organizations, to ensure and maintain humanitarian access to deliver aid and protection to vulnerable populations?
Yeah, I think that COVID-19 has really shown the importance of coordinating and harmonizing positions to be stronger, because we all faced suddenly the same issues, and most of organizations lost access in the same way. And so in that, the ability to reach common position and as a community, and was very useful also in overcoming movement restrictions and negotiating access through visas, and also the advocacy with donors for the quick release of funds, including to frontline and especially to frontline organizations. And I have to say that that has not been very successful, because so of OCHA country pool funds have been more effective than other mechanisms in providing direct funding to organizations on the ground who were able to deliver during the pandemic. And but overall, funding to national organization, community organization during the COVID-19 emergency has been unacceptably low. So there is a lot of work to do on that. But definitely the pandemic has shown the need of coordination and also the ability to deliver, to stay, and the capacity, the importance of strengthening the capacity of organizations who are on the ground and are able to deliver throughout the year, despite these circumstances. Over to you.
All right. I mean, thank you so much for sharing with us your opinions and experiences on this topic. And is there anything that you would like to add in this conversation?
No, I think it's good for me.
All right, I'm sure that your contribution will enrich our online panel discussion at the Geneva Peace Week 2020. We also hope to have more interactions with the attendees at our live sessions. So join us at collective efforts on how humanitarian organizations ensure and maintain access to deliver aid and protections responding to the COVID-19 pandemics on 4 November at 2 p.m. So thank you and see you